Could you explain what exactly Kangaroo Mother Care is?
So anyone who's seen that kangaroo animal sees that the baby is inside the pouch.
Yeah.
So the same concept we give for the humans. So the baby is made to wear only diaper and the baby is literally placed between the breasts.
Postpartum mental health. Most people think it affects only mothers. Is that accurate?
Initially it can start off as affecting the mother, but if it's not addressed, it can end up affecting the whole family, even the baby.
So, what concerns are bringing teenagers to your clinic?
Doctor, I am trying to lose weight. I am not able to lose weight. And how old is this person? 12 years old. They are in front of the mirror, like for hours together, try to scrutinize every inch of their body.
Is there something you wish families understood about postpartum mental health?
Sometimes, you treat a new mother as a patient. She's not a patient. Whatever she went through is very normal, very physiological. And fathers, if you can be a father and not just a part-time babysitter for the baby, all these small things will be a huge difference.
Welcome to another episode of the Doctor Series, where we bring trusted medical experts directly to you. In a world filled with health advice and misinformation, we believe the best place to learn about health is from the doctors themselves, who deal with these situations every day. Today's guest brings a unique perspective. She works with children at two of the most critical stages of life, from premature newborns fighting through their earliest days to teenagers navigating the physical and emotional challenges of growing up. Joining us today is Dr. Disha from Kangaroo Care Hospital. Dr. Disha is a pediatrician and neonatologist with advanced fellowship training through the National Neonatology Forum. She's also certified in pediatric advanced life support and neonatal resuscitation, equipping her to care for critically ill newborns and children in some of the most vulnerable moments. A proud Bangalorean, she credits her own pediatrician for inspiring her from a young age to pursue the specialty. One of her favorite moments in medicine is receiving newborn babies and introducing the newest member of the family to their loved ones. Welcome to the show, Doctor.
Thank you so much. Happy to be here.
Wonderful. Most doctors choose one focused area of expertise. What led you to specialize in neonatology as well as adolescent medicine?
I know it sounds like other end of spectrum because one is preterms and one is adolescent. So adolescent, I think I got interested in my post-graduation. So we do a thesis. So we pick a subject and we do, intense studying about it, do literature review. And mine was actually adolescent medicine. So I had the pleasure of meeting almost 1,800 school students, all of them adolescents from different strata. We had government schools, we had the most expensive schools, to understand what they're actually going through. So post that, I realized there's a certain way they actually want to be addressed because they're not children. Most of the time parents address adolescents as children, but after a certain, once they're 11, 12, treating them a certain way actually makes it better for the parent and the adolescent to converse with each other.
Okay.
Something to think about.
Yeah. So, for anyone who's hearing these terms for the first time, could you explain exactly what it means? Say, neonatal care, what does that entail?
So neonatal care is one of the most cutest part of parenthood because the part of a neonatologist is from the time the baby is born till the baby is 28 days old.
Okay.
So 0 to 28 is what is neonatology. And the specialist who takes care of these babies is a neonatologist.
Got it. So, if we start at the beginning of life, very beginning. So, when doctors say a baby is very preterm or extremely preterm, what does that mean?
So if we divide the total pregnancy is 40 weeks.
Okay.
So any baby born after 37 weeks is a term baby. So anything before 37 weeks is preterm. There we have 4 different differentiation.
Okay.
So anyone who's born less than 28 weeks is an extreme preterm.
Okay.
And sometimes even 30 weeks less is also called extreme preterm.
Okay.
Whereas very preterm is 30 to 32 weeks.
Okay.
And 32 to 34 is moderate preterm. And 34 to 36 is late preterm.
Okay, got it. Okay,
It's
okay.
a lot.
But of course, medicine has advanced through the decades, right?
Yeah.
So, what's possible today in neonatal medicine that wasn't possible, say, 10 or 15 years ago?
Actually, again, there's a differentiation what we can tell in India and
Yeah.
in the Western world.
Let's talk about India firstly, at
India.
least. Yeah.
So, what our forum tells us, anyone who's born after 26 weeks
Mhm.
is actually, we can, save the
We can,
baby.
okay.
But now the thing is, because of the medical legal thing, even if the baby is at 24 weeks and is showing signs of life, we are supposed to resuscitate the baby.
What do the doctors actually do to help the baby in this?
So,
What's the process?
sorry.
Sorry.
Most of the time, we'll know, right, if the mother is going to have a preterm delivery. So, the gynec's part plays a major role. So,
Okay.
they give something called corticosteroids to the mother. So, this will help in lung maturity because lung is one of the last organs to develop for the baby inside the womb.
Okay.
So, one, they give that. Second, they give something called magnesium sulfate that is going to protect the brain. So, we're trying to protect the organs even before the baby is born and try to mature those organs. And when we know it's an extreme preterm that's going to be born or a very preterm, a neonatologist will be inside the operation theater. So
Okay.
that the minute the baby is born, we are, trying our level best to give the best possible start of life. Because at first 1 to 5 minutes, the oxygen supply should reach the brain and all the other organs so that they start functioning normally.
So this is what you meant when I think in one of our earlier calls, you said neonatology is for the entire body, for every organ. That's what you meant. What do you do? Like, what's the process for after the baby's delivered?
So it depends. If the baby is having a good cry, so we just give oxygen support.
Okay.
And we try to do head to toe examination to see if there's any anomaly, something is different or abnormal with the baby. Or if the baby is not breathing, we give oxygen support along with something called positive pressure ventilation. We give extra pressure so the lungs open up because we want the lungs to open up so that all the water that's there in the lungs comes out. The baby starts breathing on its own. Then we check the heart rate. If it is above 100, then we don't do any active intervention.
Okay.
If it is less than 100, we even do compressions for the baby. Sometimes, in spite of all this, the baby may not be able to breathe. So we might have to put the tube inside the OT only, so that the baby,
Okay.
artificially starts breathing.
Are there special devices to check with? I mean, we can't really put an X-ray on such a small baby, right?
We have a monitor which
Okay.
would be showing what the heart rate is, how much the saturation is. But also, we'll have trained nurses with us
Got it.
who are as good, because they've been doing it with us for sometimes, you have that unspoken rule, just to look from me, they know what to do.
Okay.
So someone will be checking the pulse, someone will be checking the, saturation. And for the tube also, we have a laryngoscope,
Yep.
we have an ET tube. So everything is right there. Before the delivery itself, the whole thing will be set.
Okay.
So that we won't be searching for anything at the last minute.
Got it. So when parents hear that their baby needs intensive care, what are the most common fears?
So the first thing is, will my baby survive? Because they'll also know how early the baby is coming. And usually, what happens in any birthing center or any multi-specialty hospital, we will actually talk to them even before the mother is wheeled into the operation theater to give
Okay.
them an idea what to expect. So, though we can tell for 100% what it is only once the baby is born, prior we will have an idea since we would have seen so many such cases. So, we give them an idea what might be wrong, how many days the baby might require,
Okay.
what all interventions might be needed by the baby. So they'll have an idea at least, what to expect once the baby is born.
Okay.
And one thing that we always make sure we show the baby, in spite of what the condition of the baby is, the mother is shown the baby, the whole family is shown the baby.
Okay.
So that initial bonding happens then and there.
Yeah. Okay. So this brings us to what happens soon after the baby's
Yes.
born, right?
Yeah.
Let's come to Kangaroo Mother Care.
Yes.
Could you explain what exactly Kangaroo Mother Care is?
I think it's one of the most nicest part of neonatology. So anyone who's seen that kangaroo animal sees that the baby is inside the pouch.
Yeah.
So the same concept we give for the humans. So the baby is made to wear only diaper and the baby is literally placed between the breasts. So that it does many things. One, the temperature regulation will happen. So the baby actually, if the baby is very preterm or very low birth weight, the weight gain will be better because the baby won't be constantly trying to maintain the temperature.
Got it.
Second, the mother's milk secretion will increase because of the baby's touch, the smell, and the feel. Third, the bonding is there. And one more research says is the chance of infection is much lesser.
Okay.
Because of the Kangaroo Mother Care.
So when you say the research says that it's actually proven
It's
scientifically.
actually scientifically proven.
Oh, wow. So, is there benefits to the mother also?
Definitely.
Yeah.
Because, see, especially if the baby's in the ICU and the mother, after a surgery, she'll also require a couple of days to recuperate before she can even see the baby. So once the baby's stable enough, we put the baby there. Imagine the baby was inside her for all these months. So that emotional bonding and all the hormones that were made her go crazy, what's happening with the baby, all that will calm down.
Okay.
So the oxytocin hormone will increase. So she's much more happier. She's much more calmer.
Yeah. And can fathers also do kangaroo mother?
Yes.
Yeah.
Yes.
Ah.
So we even call it Kangaroo Father Care. So the father also
Wonderful.
gets included. So the actual thing is anyone can do in the family as
Okay.
long as they're healthy, they don't have any infections, and they've taken a bath and have basic hygiene. Because Kangaroo Mother Care, if you do for 15 to 16 hours a day, has proven to be much more beneficial.
Oh, wow.
Since one person can't sit in the same
So
position,
Right.
you can take turns.
Okay. Is there a specific message you'd like to tell the audience about kangaroo mother care?
Definitely. So when we have twins in the ICU, the fathers are more keen to come and do the kangaroo father care, so that, or even if it's one baby, the fathers are like, my wife's been through so much, she's in pain, she underwent surgery, and the fathers actually come and sit with the baby, and since they're talking with the baby, the bonding is so good. Sometimes the baby literally imprints on the father more than the mother. So the babies and the father's bonding is something, and also you're helping your baby gain weight, decrease chances of infection, and just you have a baby that might come to you much sooner because of the kangaroo mother care. So it's a
Very
win
nice.
win.
Okay, so let's now come to breastfeeding, colostrum, and postpartum nutrition.
Yes.
Okay, what is colostrum, and why is it referred to as the baby's first vaccine?
So colostrum is literally the first milk that's secreted the minute the baby is born.
Yeah.
So compared to the actual milk that comes later, the mature milk, this is much more watery. It's yellowish in color. So there's this myth that it's bad and it's witch's milk. But what people don't understand is it's filled with antibodies. So the mother is giving immunity immediately from birth.
Yeah.
So imagine the baby's first meal, if we can call it that, is filled with all the goodness. So you're giving like an insurance to the baby that your
Yeah.
health is going to be good. So that's why pediatricians sometimes we come across as inhuman because the mother is still undergoing surgery and we're like,
Yeah.
let's give a feed. But trust me, that first feed, especially in the first half an hour to 1 hour, can make wonders because the immature gut of the baby is sterile. So you're introducing good bacteria and they're going to
Okay.
colonize, and this is going to be forever.
Is there any situation where colostrum should be discarded?
No.
Any birthing situation which demands that?
No.
Okay.
There's only one condition where breastfeeding is contraindicated.
Okay.
It's called galactosemia, but that is also confirmed only after weeks. So colostrum, even if the mother has any infection, even HIV, tuberculosis, colostrum is given.
Wow. Okay. Okay. So now coming to breastfeeding.
Yeah.
Up to what duration do you recommend exclusive breastfeeding?
So this actually WHO has made it easy for all pediatricians. It's 180 days. 6
Okay.
months. 6 months only and only and only mother's milk.
Yeah.
Not even water.
Right.
That's exclusive breastfeeding.
Right. And so then complementary feeding begins soon after that?
Yes.
Okay.
Soon after that.
Soon after
Like
that.
immediately the next day.
Do you see common mistakes parents make when they introduce the complementary feeds?
Somehow, I think, I don't know where it got lost in translation. People feel dal water, the lentil water, is the first complementary feed should be given. For some reason, I don't know why it has been there across cultures. It's not like any particular
not just
culture.
in India.
No. Anywhere in India you go, that's like the first thing. But what they don't understand is it's literally water, which is yellow in color.
Okay.
Instead of that, you can, mash the dal and give.
Oh.
That's at least protein, not as the first meal,
Yeah.
but that can be. But somehow that dal water has become one. That is a huge mistake. Somehow I see biscuits being given dipped in water or milk or even tea for some reason.
At 6 months?
At 6 months.
Okay.
Or they want to just start off with Cerelac, anything packaged. See, the thing is, the packaged fruits last this long because of all the preservatives. You don't want to spoil that nice gut that has healthy bacteria. Anything that's home cooked, that's homemade, is always preferred. So something simple. Usually we start either with a rice porridge or a ragi porridge
Mm.
because it's one pulse and it's easily digestible
Right.
and it's small quantity. So the baby also needs to learn the texture of the different food because for 6 months the babies had only milk.
Yeah.
So something that is small and easily digestible is what would be the ideal first complementary feed.
Okay. And until the 6 months, or even after, how does one identify whether the baby is getting enough milk?
So the best thing to do for a mother is you see the diapers sizes keep increasing. The
Okay.
clothes that fit 1 month ago is not fitting.
Okay.
And when you hold the baby, you can feel that, the weight
The weight,
has
yeah.
increased. And the easiest thing to do is if the baby is passing urine 6 to 8 times a day,
Okay.
that's in 24 hours, that shows your baby is getting adequate milk. And anyway, they keep going for vaccination. We check the weight. So you
Right.
can plot it and see, yes, my baby's, gaining
Okay.
enough weight.
Many mothers receive conflicting advice after delivery, especially in India, right? So,
Yeah.
what's a healthy postpartum diet?
Anything that the family is eating.
Okay.
Whatever the family is eating, the same has to be given to the mother because it's a complete meal. Usually, what we have, it has some protein, some good fats,
Hmm.
vegetables, and our rice or chapati.
Right.
So everything she has to get because if she gets the right nutrition, the baby is going to get the right nutrition through the milk.
Correct. Okay. And are there any foods mothers should completely avoid?
Foods, no. Others, yeah, definitely no smoking and alcohol. Other than that, foods, especially anything that's homemade, should be okay.
Okay. Coffee?
Caffeine, 1 cup a day should be okay.
Okay.
Decaf is good, but
But
most of the time you're
it's
so sleep deprived, you need that caffeine hit. 1 cup is definitely okay.
okay. Okay, so let's understand what happens beyond discharge. Okay.
Yeah.
Many people think like the birthing journey ends once they
Leave
leave the
the
hospital, but why is follow up such an important part of the birthing itself?
See if the baby is normal.
Hmm.
Even then, if it's a term baby, good weight baby, even after discharge, we ask you to come back after 2 to 3 days because we want to check the jaundice.
Hmm.
Jaundice can come till 2, 3 weeks.
Okay.
Sometimes can come till a month. So we want to track that because you don't want to miss the jaundice because higher it goes, the chances of it reaching the brain is very high.
Okay.
And that's irreversible.
Oh.
So that's the main thing we ask. Second thing, we want to make sure the mother is feeding properly because for first time mothers, the position, the latch, it'll be too complicated.
Correct.
And the first 3 days when she's in the hospital, this, like you said, information overload. Maybe she wouldn't have understood what the lactation consultant is telling her.
Hmm.
So we want to follow up that also. And another thing is we want to make sure the mother is also okay, the baby is also okay.
Okay.
So that is the reason we ask for follow up in a term baby. Whereas in our extreme preterms, very preterm, we ask for follow up because we want to check how the hearing is, how the eyes are. We have to check up how the milestones are going for the baby,
Yeah.
how the brain development is. Sometimes we'll even ask for a brain MRI after a few months.
Okay.
Just to make sure whatever happened in the NICU didn't affect
Okay.
the baby.
So the milestones are different for a preterm, extreme
Yes.
preterm, and a
And then
full term
yes.
baby.
Yes.
Okay.
Because whatever chart we give you for milestones, it's all for a term baby. So for a preterm, we have to adjust it, and then sometimes the mother will be like, "My child is 1 year old. The child is still not crawling, and other children are running around." There's a difference because your baby came that early. So
Yeah.
we give almost 6 to 9 months for the baby to catch up.
Okay. So what's it like seeing former NICU children come back as, healthy children and running and speaking to you?
I feel that's one of the greatest joys of life. And sometimes the parents are so nice to us, they actually invite us to the baby's first birthday or the naming ceremony. So seeing that baby thriving and all normal literally makes you reaffirm that whatever you're doing in life is actually good.
Okay.
I mean, it's something that I think no other happiness can be compared with.
Obviously, that's a wonderful memory.
Yes.
But then there's reality of postpartum depression also that's fairly common or increasingly spoken about lately. Most people think it affects only mothers. Is that accurate?
See, initially it can start off as affecting the mother, but if it's not addressed, it can end up affecting the whole family, even the baby.
Oh.
And weirdly, we talk only about postpartum depression, but this is like if you take this as the middle, there's one prefix and one suffix to it.
Oh.
The prefix is postpartum blues, which is more common than postpartum depression. Almost 50 to 70% of women go through it.
What is that?
So, postpartum blues starts off immediately within a couple of days of delivery. Usually, it's self limiting. Within 2 to 3 weeks, it should reduce. But the mother is very emotional. She'll be crying at, the most. For most people, it'll look like a silly thing. For the mother, it'll be something extremely important.
Yeah.
Or she'll be very angry, or she'll be very anxious. There'll be sleep disturbances. These are one of the first things the family and the partner notice
Hmm.
in postpartum blues. And most of the time, by the time 2 3 weeks passes, she comes to term with it and she adjusts. Whereas in postpartum depression, it continues.
Hmm.
And it goes on to the stage where, the disconnect happens with the baby. She's, the sleep is gone. She's not able to eat food. There's no interest in taking care of herself or the baby. The very act of getting up in the morning becomes a chore for her. And the worst one that nobody wants to see, which is in fact a medical emergency, is postpartum psychosis,
Oh.
where they, without knowing, they invariably end up harming the baby. You would have read in a paper the mother would have chucked the baby from some 10th floor. It's postpartum psychosis because she is not able to understand what's happened to her. It's become so bad, and she feels the baby is the reason whatever is happening to me is happening.
Cool.
So, eliminate the thing, eliminate the problem. So, baby is the problem. So, that's why it's important for the family, the partner, to keep an eye
Okay.
because she's not doing it because she wants to do. It's beyond her control. And most of the time they feel so lonely, right?
Mm.
Because the confinement is such a big thing in India. You're a new mother, you and the baby are confined to the room. Don't come out of the room. Don't, do anything. So imagine someone is in the room 24/7, sleep deprived, with no human interaction. All these thoughts. Sometimes it can even go as bad suicidal thoughts.
Hmm.
So that's why, it needs to be spoken about more and more.
So before it gets that bad for anybody who may be
Mm.
watching, is there a warning sign or a couple of warning signs wherein they know that they need to seek medical advice?
So one thing that you can see is you don't recognize yourself when you look in the mirror.
Okay.
The way you used to be. One of the first things most mothers tell is, my partner is telling me I'm much more angry these days. Any talk is ending up as a fight.
Hmm.
Or for you, you're feeling very worthless. Or you're questioning your identity. Am I just going to be someone's mother from now on? Is this all I'm going to be? So all these things are the first things that start.
Okay.
Or you're like super tired, but you're not able to sleep because your brain is, overthinking or thinking about things that are actually not happening. Or you have no interest in food. So these are the first signs that you should, if you're experiencing it, please talk to someone. Nowadays, actually, most pediatricians are asking the mother when she comes for the follow up, like, how are you? Is everything okay? Is everything
Okay.
bothering you? And if we feel something's amiss, we actually, make her redirect her to the psychologist so that they can just talk in a non-judgmental environment.
Got it.
Because sometimes in the house, if they try to talk, the mothers or the mother-in-law will be like, we gave birth to so many children. We never went through this.
Yeah.
You young girls. And it's very normal. And I don't blame them also because that time maybe they couldn't voice it out or they had such big families to take care of the children that it didn't feel like a burden.
Right.
Here, since you're doing everything, it can be overwhelming.
Okay. So, is there something you wish families understood about postpartum mental health?
First thing, my sincere request is don't isolate her. Best thing to do is have a meal as a family.
Okay.
Make her feel included. Let her know what's happening in the outside world. By shielding her, you're making it more of a problem. Like sometimes, you treat a new mother as a patient. She's not a patient. Whatever she went through is very normal, very physiological. So make her be part of everything. And fathers, if you can be a father and not just a part time babysitter for the baby, not just changing the diaper. Come home, be with the baby for 2 hours. Let her, just she can do whatever she wants. She can go for a walk, she can read a book, she can talk to her best friend, or even go for a coffee.
Yeah.
All these small things will be a huge difference because,
On a daily basis. Yeah.
yes,
Yeah.
because It's an everyday thing. It's a 24-hour job to
Big.
make a new mother.
Yeah. Okay, so you spend a part of your career caring for the smallest, most valuable patients.
Yes.
And then at the other end of the spectrum, you're working with teenagers facing a very different set of challenges. Let's talk about that a bit. Um, what are the biggest challenges you've seen with teenagers in the last few years?
I think with the advent of social media, with everything being so, glossy and photoshopped, everyone is trying to chase that image.
Okay.
See, anybody who looks at I mean, magazines are no more a thing. So you see an influencer's post, and she or he looks so perfect and so well put. No human can look that perfect 24/7. It takes a lot of makeup, photoshopping, editing, proper lighting. All that makes sense. Like, even the skin, the very pores of the skin has become a debate now. Like, everyone wants poreless skin. How can that happen? Anybody has pores. It's just that the lighting is making it,
Yeah.
look like nobody has pores. And it's affecting them so much mentally that it's becoming almost a crisis, I might say.
Oh, wow. So, what concerns are bringing teenagers to your clinic more than before now?
Doctor, I am trying to lose weight. I am not able to lose weight. And how old is this person? 12 years old, 13 years old. And that's the time when your body is again going through that growth spurt, right? You're going to gain weight.
That's probably premenstrually
Yeah,
then, right?
yes. So it's normal. All the fat should go where it's going so that you look like a woman at the end of the day. But somehow everyone has that perception, right? And though, fashion is trying to be more inclusive, I don't think it's reaching everybody because most of the people that they see is a particular size and everyone's trying to chase that. So, one is that. And somehow that actually it's been coined a term, it's called body dysmorphic syndrome or a body dysmorphic disorder, BDD.
Okay.
And now we have questionnaires for that so that we know if a child or a teenager is somewhere in the spectrum. We want to confirm so that we can help them better. There are actual questionnaires for that.
For parents who are unfamiliar with it, are there warning signs?
Yeah, so first of all, I think we need to understand what it even means, right? Because it's a very medical term. So the perception means what we are thinking. It
Mm.
may or may not exist. So these teenagers, they are trying to find that one thing that they perceive or think is abnormal and they obsess over it. It might be a shape of the nose or the very body structure or a hair or anything. Or sometimes it's complete.
Mm.
And they're thinking so much about it that that becomes the main point of focus in life. So for parents, what they can say is if the teenager is suddenly becoming a little antisocial, doesn't want to come for any event.
Mm.
If they're taking picture, they're trying to avoid not being photographed because they feel they don't look a certain way. Or they're in front of the mirror, like for hours together, try to scrutinize every inch of their body. Academically, suddenly there's a deviation. A child who was getting 70-80% is hardly passing because the whole thought is on something else, and they become more anxious, they become more argumentative,
Okay.
so nothing seems right with them.
Without revealing any identities, is there a particular case that stayed with you?
Yeah, I think this was during my post graduation where I realized how big it can actually get. So she was a 13-14-year-old still in school, one of the top students, became so upset because her friends were looking more feminine than her.
At what age?
13. So she hadn't started her menstrual cycle. So she still had time. And because the parents were more, they were extremely busy, successful professionals, it became such a, mentally challenging for her that she actually tried to do self harm.
Okay.
Thankfully, the father found her before anything could go wrong, and it took a lot of time for her to actually acknowledge what was bothering her. Because initially, everyone thought something in studies or some teacher must have told her something for her to take such a drastic thing. No, it was just the way she looked. And mind you, she was a very pretty child. But it's just that her friends were much more prettier, they had more access to makeup. So she was comparing with her peers. This was not even someone on social media, it was literally her own friends. And that started bothering her so much. She's like, why can't I look like them? Why can't I dress like them? Why don't my body look like that? And it became a point of obsession for her
At 13.
at 13. So you can
Gosh.
imagine how it will be at 15, 16 when the actual changes will happen.
Okay. Has social media been significant in these sort
Uh,
of cases? Yeah,
Unfortunately,
it
because
would be.
I feel one of the coolest and the most glossy profession everyone wants is to become a beauty influencer. Most people don't know actually those people also would have struggled to get where they are. It's not like it's an
Yeah.
overnight success. So to become that, they're ready to even go through, go under the knife, though the legal age is for you to be an adult. We can have someone very young also want to change the shape of their nose or even eyes, because Korean skin is the new trend. Everyone wants that glossy glass skin. But at what cost? Because this is a time for you to actually evolve as an individual.
Yeah.
Because instead of that, we are obsessing over one particular, physical aspect that can be changed anytime with the right makeup, right?
Yeah. But do they also make changes in the nutrition and diet and trying to follow the trends or trying to fit a certain size and type of
I'm
body?
so glad you asked this question. There are 12, 13-year-olds who want to do intermittent fasting because some celebrities spoke about it, or they want to cut down on all carbs, no carbs, only protein because they want to have a keto diet, or they just want to have like something very small just before they feel like they're going to lose consciousness, so they can just go through the day, and all the nice boxes that are sent by their parents just returns or it's just emptied into a bin, because they feel if I eat I'm going to bloat, I won't look a certain way, or I want to look a certain way, so let's stop on cut down on the food. But what they don't understand is adolescent is the age where they actually need more nutrition,
Mm.
because the growth spurt, the bones, everything happens then.
So, what happens when growing children start restricting their food intake? Is there concerns? What are
Yes,
the
big
concerns?
concerns. So if you cut down on your carbs, the brain functions only on
Mm.
carbohydrates. So you'll have that brain fog, fatigue, everything. You cut down on protein, the muscle mass won't develop.
Right.
So again, you might look thin. There's a way to look thin and there's a way to look toned. All of us should look toned. The muscle is actually toned and working right. So the muscle mass will decrease. And most scary thing is there'll be a lot of deficiencies in them. There'll be iron deficiency. Anyway, India has normally only if you check, most of them will have anemia. So you're not even eating. Iron deficiency is definitely there. There can be B12 deficiency because they're not getting any food. B12 is definitely going to be there when most vegetarians, because we don't have a vegetarian source particularly for B12. But if you're not eating only, B12 can happen. Vitamin D3 deficiency will happen because nobody wants to go in the sun, right?
Mm.
Because everyone's afraid of being tanned. That can happen. Folate deficiency. So you can imagine how much of deficiency that can happen. And somehow the water intake is also drastically decreased in people. So you're dehydrated also. So it's like everything is going wrong there.
Are eating disorders a thing?
Big time. So again, going back to my thesis, it was both body dysmorphia along with eating disorders, is what I checked.
Okay.
With the questionnaire, completely, anonymous. It was very scary what we saw, because we feel eating disorder is something that happens only in the beauty industry, in modeling and all
Right.
that. But no, it's very much prevalent in India, in Bangalore actually.
And do you see bulimia in teenagers?
Yes, because see, having anorexia is more difficult because we stay in a family as a unit. So the mothers are constantly seeing what you're
Mm.
eating. So they can't skip a meal, at least the dinner and the breakfast. Whereas bulimia is more easy, they eat in front of the mother
Mm.
and everything is just thrown out immediately, forcefully. And that is even more scary because no nutrition is going inside. They have those physical signs where the bones are brittle, like you see even osteoporosis in these young children, because the bones are just breaking, like one small fall and it's broken.
Oh my
Or
God.
the skin is like full dry because there's no nutrition, there's hair fall. They go months or years without having a period because the baby sorry, months without having periods because the body's on survival mode. All the body's trying to do is keep the child alive. So
Okay.
where will other functions happen? So it's a very scary thing, and I think all parents should have a look out for this.
So it's in survival mode rather than thriving.
Thriving, and it should be in the thriving mode because this is literally the foundation for the rest of your life.
Right.
And instead of that, the body is just barely there.
Okay.
Like there's no energy to do anything. Sports classes are missed. All this teenager wants to do is sit because there's no energy to sit also sometimes. They're just lying down. So parents, I think, should have an eye on this also, along with the body dysmorphia.
Okay, so let's take the other end of that spectrum. Say the extreme glamorized gym and bodybuilding world, maybe more common in younger boys. Has that influenced them? Do they try to take protein supplements early on?
Excessive protein supplements. The scoop is there.
Hmm.
One scoop is enough. So imagine they're chugging 4, 5 scoops along with other supplements, like they're taking creatine. You're not a bodybuilder to take all these supplements. Protein is enough because most of our diets is not protein rich, right?
Hmm.
So especially South Indian diet is more of carbs. So take the protein supplement, but they're taking other supplements or they're taking steroids because they want to have that well-defined muscle. No teenager requires all this. I'm sure all of us are seeing, Vaibhav Suryavamshi.
Mm.
You see the way he looks. He looks like a kata pita bacha. Eat, eat and exercise. You will get the muscles later on. Nobody is expecting a 14-year-old to have the muscles of, some famous bodybuilder. I'm
Right.
sorry, I'm not familiar with the names. But please don't take these unnecessary supplements.
So, at what age is it okay for a child to take protein supplements or adolescent child?
So for an adolescent, if you're on, doing extreme sports,
Hmm.
like you're training 5 hours, 6 hours a day, then 13, 14, you can start because you need that extra protein. But if you're a regular teenager with regular activities, wait till you're 18.
But do it
This
with a nutritionist.
do it with a nutritionist.
Get the
Don't
right
take anything
supplement.
over the top because there's
Yeah.
so many again now, right?
Yeah.
And each one is trying to claim that they are better. Anything, go to a professional who's actually done that for a living.
Yeah.
Not some influencer who's like, I take this protein today and tomorrow is this protein. Please don't do that. Go to the right person for the right information.
So I did, when you said steroid, recently heard of a steroid called Reta, apparently popular amongst the young teenage boys. What do you have to say about that?
So I think with the advent of Ozempic and Monjaro, there are other GLP-1 and 2s that are coming to the market. This was actually started for people with uncontrolled diabetes and who are overly obese.
Hmm.
You know, BMI of 35, 40. They were the targets. But now somehow, Papa, they're not even getting the medicine because the others are, clearing off the shelf. No, boys need this. None of you need it. Eat the right nutrition. If you want, you go to a nutritionist. Get the right nutrition for you.
Yeah.
If you want to, build muscles, there's a way to do it too. And it will require time. If anything is giving results within a week, within a month, if it is too good to be true, it
Question.
is.
Ah,
Don't take it because it is too good to be true.
right.
Anything that's giving instant results won't give you a lifetime of results. And none of us want to look that, that face, that typical Ozempic face
Right.
where the muscle mass is completely gone. You know why? Because they're taking the injection, they're not doing the right nutrition or the exercise with the fear that they'll gain back the weight that they've lost. But if you don't do it right, it's going to do more harm. And for a
Mm.
teenage body, it's irreversible.
So even for boys, could it affect their hormones?
Yes.
And
Affect their hormones, their even height.
oh, oh,
So if you want to look a certain way, do the basics right. That's what I was taught in med school. Do the basics right as a doctor. Same way, do the basics right. Get your nutrition sorted, sleep sorted, exercise sorted. Life will actually be thriving and beautiful.
so what's an ideal plate look like for a teenager?
So if we show it in a circle.
Yeah.
So 1/4 should be your fresh vegetables and fruits.
Okay.
So we tell at least 5 different category of fruits and vegetables every single day. Anything that's seasonal. 1/4 will be your protein with good fat. 1/4 should be the carbs.
Hmm.
So this itself completely will be a balanced meal for them.
Okay. And how important is sleep and physical activity?
Big time. Big time. It's like if you take a triangle, these three are the corners. The nutrition is on one corner, exercise in one, and
Yeah.
the sleep in one. So what is happening? Everyone's doom scrolling for some reason, even in the night. I mean, most of us would have done once in a while,
Yeah.
but this has become a trend, right? Everyone's on their smartphones. So sleep is definitely going to be restricted. They require 8 to 10 hours, adolescents,
Okay.
because the brain actually is still developing. The brain also needs rest. You need to cut down on all the unnecessary information we are,
Right.
dumping on it.
Yeah.
So sleep definitely very, very, very much needed. Otherwise, how are you going to go through the day?
Mm.
Or you'll just be like the teacher will be teaching and your brain will be like, okay, let me just catch up on sleep, because brain is also Papa overworking the whole day and night.
Right.
Coming to exercise, we need exercise so that the muscles will actually be the certain way that we want it to be for the rest of your life.
Correct.
And the bones.
Mm.
Imagine someone who's been a couch potato as a teenager itself. By the time that the person is 30 or 40, every back issue, pains, aches,
Everything.
everything will come. Other and the other end of the spectrum is if you're exercising. I'm not telling every day, at least 5 days a week. 60 minutes. I think all of us can afford that much, especially adolescents. Whichever works, morning or evening. And you can see the difference in them. So if all three are done, adolescent health will be. And most important thing that I forgot to mention, because of this crazy dieting, the menstrual cycles are getting very disrupted in girls.
Mm.
Because the body, whatever little nutrition is getting, is trying to sustain all the important organs, like the brain and the heart and the gut. So the uterus is not even working properly.
Mm.
And this will become a major issue in the later age when they're trying to conceive, right?
Yeah, because that's the formative years, no?
Yes. So please, this is really not the time to diet.
Got it.
Healthy food. Have anything that's homemade. Your mom will make the right food for you.
Okay, so we're now coming to Mythbusters. Okay,
Yes.
let's bust some myths. So I will tell you some statements and you could tell us whether that's fact or fiction.
Done.
Okay. If a mother hasn't breastfed or expressed milk for a few hours, the milk gets spoiled and should be discarded.
Definitely a myth. Fiction, fiction, fiction. Though it's one of the most commonly asked questions in the OPD by
Oh,
grandmothers.
okay.
Madam, she's working, okay? So when she comes, I make her, discard that milk, then fresh milk. Like, how is this milk cold and that is fresh? Both are in the same place.
Okay, so if the mother eats vitamin C rich foods, her milk becomes sour.
Definitely a myth. Vitamin C food is needed for the mother for her to heal post the surgery. Please give her the oranges and the musambis and the guavas. No, milk won't become sour.
Okay. A mother should stop breastfeeding when she gets her menstrual period.
Oh, yeah, this is one of the most favorite things for every pediatrician. Nothing is going to happen. The milk won't change its taste, texture, nothing. Please continuing to feed in spite of menstrual cycle. Don't stop. Myth.
If a mother eats rich or spicy food, the baby will automatically get a stomachache.
This is why I think Papa, the mothers get such bland food, right?
Yeah.
No, babies. No, baby will get the right milk only, no matter what the mother needs. Please let her have normal food.
Every time a baby passes urine, it means the stomach is empty and the baby needs immediate feeding.
You know why this happens? This again, it's a myth, but I'll give a little information about this. Because the baby cries after passing urine, right?
Huh.
Baby's crying because it's discomfort for the baby. It's wet for the baby, not because the baby
Okay.
is hungry. And what is coming out in urine is what was stored in the kidney. Stomach is a different organ where the milk is in.
Okay.
So they're not related to one another.
Yeah. Okay. Got it. Colostrum should be discarded because it's dirty.
It's not. It's literally nectar. It's golden milk. Don't discard it. Give it to the baby. Even if the baby's on ventilator, we take the colostrum and do lip smear for the baby.
Oh.
And we would have anyway inserted a tube through the nose, right?
Yeah.
We give 0.5 ml, 1 ml to the baby every second hourly to activate the gut, even if the baby is on ventilator.
How do you store it?
Like storage of express milk is wonderful. We can store in room air for 4 to 6 hours.
Even colostrum?
Yes.
Okay.
In a fridge for 1 to 3 days. In a deep freezer for 3 to 6 months.
Okay.
Can be stored. Don't
Interesting.
discard.
Okay. The next myth. A newborn needs honey, sugar water, or gripe water.
None of them. What the newborn needs is the mother's milk, mother's milk, mother's milk. Nothing else. Please don't give honey and sugar water. You're just disrupting the gut and the source of infection for the baby.
Okay.
Because honey can be polluted with something called botulinum toxin. It's a toxin, and that can actually cause serious repercussions to the baby, including the baby getting admitted to the ICU and going on ventilator.
Even the raw, pure honey.
How do we know it's raw?
That's it. That's it.
Exactly,
Goat.
it goes. No, even if it is, the source also, no honey till 1 year.
So, why is gripe water bad?
Because I think as Indians, we don't see the backside of anything, the packaging. The packaging looks good and fine, has all healthy things, we're like good to go. But if you see the ingredients, it has alcohol. Do we want our babies to get alcohol? Right? Definitely no. It has soda bicarbonate, so excess of sodium causes something called hypernatremia. So sodium levels will drastically increase. It can even cause seizures in a newborn baby, in an infant. And imagine seizures in a small baby.
Wow.
So please, gripe water is definitely doing more harm than good. And it's propagated as something for gaseous baby, right? Like the baby is feeling very gassy. There's some simple things that the mother can do. You put the baby on tummy time. So put the baby on a flat surface, preferably on the floor, so that there's no risk of falling. It does two things. The gas comes out. Second, the neck strengthening will happen. So the neck holding will be faster.
Okay.
And the core strengthening will happen.
Okay.
Isn't that what we want? Or you do cycling for the baby. Make the baby lie flat on the and do cycling. Definitely the gas will come out. And if you still feel baby's abdomen is very tense, then that's something much more serious than just gas. Come to a pediatrician. We will sort it out. Gripe water is an over-the-counter drug which should be banned. Like how ORSL was banned by Dr. Shivaranjani, gripe water should be banned.
Okay. Breastfeeding should begin only after the mother's milk fully comes in.
Fully will come in only by 1 week.
Okay.
The mature milk, because first will be colostrum for 3 to 5 days, then the transitional milk, then the mature milk. So you're going to starve the baby for 1 week? Please don't. Whatever milk that's coming out of the mother, give the baby.
Okay. A crying baby always means the baby doesn't have enough milk.
Oh, this is every grandparent's favorite thing. Baby's crying, feed the baby. Babies can't talk like us, they can't communicate like us. Anything that's happening with the baby is communicated through crying.
Okay.
So if the baby is crying, baby might be sleepy, baby might have passed stools or urine, baby might be feeling cold, or something might be even itching. So imagine the baby's bum is itching and the baby is feeding the baby. We will continue to cry only. No. Poor thing. So you do all this. Still the baby is crying, then feed the baby. Every time baby is crying, please don't feed, yeah. Mother will be exhausted, baby will also be tired. Baby's not getting sleep only. So all the energy is going in drinking only.
Okay. Babies need water with the breast after the breast milk.
Why baby wants to gargle the mouth? No, please don't. Water should be introduced only after starting complementary feed. For 6 months, only the mother's milk, along with that vitamin D that we give. Nothing else, no water.
Okay. And jaundice is always harmless.
No. If jaundice comes within 24 hours after birth, definitely it's pathological. If the jaundice has kept on increasing, is involving the palms and soles, definitely a cause for concern. That's why we take jaundice so seriously. That's why we keep repeating it.
Okay.
Jaundice is not harmless unless we tell otherwise.
Okay.
Has to be evaluated. If the hands and palms and soles are yellow, definitely rush to the doctor immediately.
Got it. Thank you for that very, very informative chat. We're coming to a close. Do you have closing remarks for the audience? Because you deal with children at different stages before they're young adults.
Yes.
So is there anything specific you'd like to share with the parents?
Most importantly, try to be a present parent for your children, especially your adolescent. The more present you are, the more they'll open up to you. So you don't have to, be that helicopter parent, try to stalk them or have a separate Instagram just to, know what's happening with your child's life. So be a present parent, try to have an open conversation. That's definitely going to be helpful.
Yeah.
And coming to my preterm parents, first of all, you're doing a great job, but please come to follow up. Preferably with the same doctor who treated your baby so that they know what the baby has gone through all the time. And secondly, stop taking advice from random people who don't know what they're talking. And stop taking advice from online influencers who are not doctors. Any doubt, reach out to your doctor for the right advice.
Yes. Thank you, Dr. Disha. This conversation reminds us that good health starts way before adulthood. Okay. So, whether it's supporting premature newborn, encouraging healthy habits in adolescents, or recognizing mental health challenges early, informed parenting makes a tremendous difference. So, if you found this episode valuable, share it with a parent, an expecting parent, or anyone involved in raising children. We'll see you in the next episode of the Doctor series. Thank you, Doctor.
Thank you.